Family planning. When we think of contraception, often the thoughts of condoms and pills come to mind. These are not our only methods of contraception, however. The next session of this tutorial looks at natural methods and how these can be used to prevent pregnancy. Family planning uses a low-resource approach to protecting against pregnancy by predicting an individual's position in the menstrual cycle and resulting risk of having unprotected sex. By combining a daily review of one's body temperature and cervical mucosal secretions with an established knowledge of menstrual cycle length, this data can be interpreted to work out whether a person is currently fertile or not. Family planning offers several advantages. Evidence show that it can be up to 99.5% effective in preventing pregnancy in perfect use, giving merit to this approach. Further, family planning does not require extensive resources, unlike other contraceptive methods such as condom use, which require changes every time. This links to the idea of side effects of contraceptive use, a factor that is not relevant to family planning methods. Family planning can be used by anyone without contraindication and does not pose any health risk. It is also more widely accepted by certain groups who may not approve of physical contraceptive use. By contrast, family planning is not without limitation, however. Family planning is not protective against STIs. Furthermore, it can be difficult to time family planning methods appropriately, and active commitment is required, as is evidenced by the practical nature of the approach. This highlights the fact that family planning methods can have both advantages and disadvantages. A second natural method, called the lactational amenorrhea method, can also be used by a parent for up to 6 months after the birth of their child. If a choice is made to breastfeed with no supplementary feeds, a physiological process is established in the body that protects the parent from becoming pregnant again. This can be up to 99.5% effective in preventing pregnancy in perfect use. Unlike other family planning methods, the lactational amenorrhea method cannot be used permanently, however, with parents needing to make choices around how they will continue to use contraception. This concludes our discussion of natural methods of contraception. Join me in the next tweet to continue our journey in making sex safer and more pleasurable for all.